Do you know someone with a serious disease, with a prognosis of 6 months or less to live if the disease runs its normal course? Have you been worrying about making the transition from medical care to end-of-life care? Are you unsure about what to expect as a patient or what your loved one will go through during their end-of-life journey? In this video, we want to help walk you through what you can expect from hospice care. Who can make a referral? What happens during the initial meeting? How are patients' goals of care determined? What kinds of medication and equipment are provided? Is choosing hospice a permanent decision? We will answer all of these questions together. Nathan Adelson Hospice has helped guide thousands of patients and families through this emotional and stressful time. We've learned that when a patient is no longer able or no longer wants to treat their terminal illness, their priorities change. Patients begin to search for a way to increase the quality of life during their final days. That becomes their main concern. Many people find that hospice is the right answer for them or their loved one. Hospice is the only part of the healthcare system specifically designed to meet the needs of patients and families when a patient no longer seeks to cure their life-limiting illness. Although there are differences between hospices, most high-quality hospice organizations follow certain practices and routines in the delivery of care. Who makes the referral for hospice? Typically, hospice is considered when multiple physicians agree that prognosis indicates the patient has less than 6 months to live. This prognosis doesn't mean the patient will necessarily die during the next 6 months, but it is a realistic possibility. While most referrals to hospice come from physicians, other people may refer a patient too, such as case managers, social workers, family members, friends, or clergy. Patients are also able to refer themselves. Consider inquiring about hospice care as soon as eligibility is determined. The sooner the patient enters hospice care, the sooner they can take advantage of services that will improve their quality of life, reducing the physical, social, and emotional burdens on the patient and their family. We've put together a separate video that explains in more detail who is eligible for hospice. Click the link in the description if you're interested in exploring that topic further. What happens during the initial meeting? Once a patient is referred and agrees to hospice care, the team arranges for a specialist to meet with the patient and family. This hospice consultation can happen in your home, at the hospital, or any other convenient location. The purpose of this visit is to make a comprehensive assessment and fully understand the patient's and family goals and preferences. What is the role of the plan of care? Using the information from the assessment, an interdisciplinary group of hospice professionals develop a plan of care, which aligns with the wishes of the patient and family. The care team is composed of physicians, nurses, certified nursing assistants, social workers, specially trained volunteers, and spiritual care providers. With the family, the team schedules regular nursing visits, assistance with personal care, and emotional and spiritual sessions requested in the plan of care. We have a separate video about who is on the hospice care team that describes each person's role and how they contribute to caring for the patient. Click the link in the description if you'd like to learn more about the hospice care team. Who provides the medication and equipment? All prescriptions related to managing pain and comfort are delivered to the home along with durable medical equipment, such as hospital beds, monitors, walkers, and more. In general, hospice will assist in any way it can to make home care as convenient and safe as possible. Is choosing hospice a permanent decision? Although most people who enter hospice stay through the end of life, hospice isn't always a permanent choice. For example, If your kidneys are failing, you might choose the hospice program rather than continuing with dialysis. But you can still change your mind, stop hospice care, and start back on treatments. Other people may get better unexpectedly and quit the service with the option of returning later. What happens during the final days at home? When a patient begins to show symptoms that their final days are near, the team will adjust the level of home visits to meet the needs of the patient and their family. Once the patient passes, the staff will assist with final details and paperwork and provide bereavement support to the family. We've put together a more in-depth article about what you can expect from hospice care on our website. If you wish to explore the topic further, you can visit us at nah.org or click the link in the description. As a part of this hospice education series, our next video will discuss who is on the hospice care team, their roles, and how they can help care for hospice patients. Keep in mind, the fact that you're exploring hospice care is a very positive sign. It means you're considering how to bring quality of life and compassion to your loved one and family. The philosophy of hospice is to provide support and care so that people with life-limiting illness may live as fully and comfortably as possible. Here at Nathan Adelson Hospice, we do all we can to make sure that no one ends the journey of life alone, afraid, or in pain. Thank you. If you have additional questions about hospice, feel free to reach out to us or leave a comment below.